Good evening, ladies and gentlemen, and welcome to the Career Development Institute. Today, we'll be looking at Community Health and Nutrition, Module 1, the first lecture. Okay, now we'll look at course objectives, and here we'll be defining health and nutrition, understand the issue of health and nutrition in development work, introduce health and nutritional systems, use health and development models. Then module outline will be looking at introduction to the concept of health, the difference between public health and community health, elements of primary health care, determinants of health, the Millennium Development Goals, the Sustainable Development Goals, health as a basic right, disease trends, and then conclusion. Now, lesson focus. Introduction to the concept of health, the difference between public health and community health, elements of primary health care, determinants of health, and then lastly we'll look at the summary of the whole course. Beginning with introduction, we see that advances in health and nutrition in developing countries may be attributed to specific deliberate health and nutrition related interventions and to changes in the underlying social, economic, and health environments. Moreover, the experience of community-based programs linked to nutrition constitute a significant part of the body of knowledge on ways of improving it. Look at what health is all about. Health is much more than the absence of diagnosed physical disease. Now, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That was stated by WHO in 1948. The 1978 Alma Mater Conference defined health as an outcome of interaction among social and economic factors and as fundamental human rights. The conference also adopted primary health care to achieve health for all and called for multi-sectoral and multidisciplinary actions. The CDC Foundation defines public health as the science of protecting and improving the health of people and their communities. Now, public health professionals work to prevent the spread of illness in a particular population, which can be as small as a single neighborhood or as large as an entire country. Their work is largely preventive, as they take steps to ensure that a population has clean food and water, and design informational campaigns to teach the public about health and wellness. Community health is a major field of study within the medical and clinical sciences, which focuses on the maintenance, protection, and improvement of the health status of population groups and communities. For example, a collaboration with CBOs and residents to focus on prevention by supporting policies and environmental changes that promote healthy eating and active living in neighborhoods, schools, and workplaces. Community health has a similar goal to public health, but takes a slightly different approach to keeping a population healthy. Instead of studying disease directly, community health focuses on how factors such as socioeconomic hardship and cultural standards affect overall health. Continuation on what health is all about. you see that the greatest difference between the two fields lies in their respective focuses. Now we see public health focuses on the scientific process of preventing infectious diseases, while community health focuses more on the overall contributors to a population's physical and mental health. Now we bring to you the elements of public health care. Promotion, that's the first one. We have promotion of proper nutrition and adequate supply of safe water, basic sanitation. Secondly, we have maternal and child care, including family planning. And thirdly, we have immunization against major infectious diseases. And the fourth, we have prevention and control of locally endemic disease. Fifth, health education concerning prevailing health problems and methods of prevention control. Sixth, we have treatment for common disease and injuries. Determinants of health. We have a chart here. When you go through, you are going to see most of the determinants of health. And now, these are the determinants. We have income and social status, social support networks, education, employment, working conditions, social and physical environments, personal health practices and coping skills, healthy child development, biology and genetic endowment, health services, gender, culture. Now, the summary of the whole course, we see that the concept of health is linked with other issues that work in synergy to make it relevant. In this context, aspects related to health, healthcare services, community engagement, as well as allied issues of concern such as nutrition and policy have to be considered in order to paint a better picture of the development worker. Thank you so much. God bless you. See you in the next class.